Hi, hot topic review for today is going to be about the measles, mumps, rubella outbreak that's stemming in southwest of the United States, greatly affecting Texas right now in Gaines County. Rubella being the respiratory infected disease, and that comes from access and contact with droplets, either from nasal or airway passages through coughing or sneezing. Droplets are active for about 2 hours on contact surfaces, and some of the things that we're seeing is 48 new cases have stemmed since January of this year in Gaines County. What we're seeing with a lot of those cases, where majority of them were under 17, most 13 of those particular cases were the age of under 4 years old. What we've seen with the population in Gaines County is there's a larger increase with homeschool and as well as small private schools. Now, those particular being mentioned is that they're not going to have grade of commercial cleaning products that standard schools would have, and they don't regulate under the same guidelines as normal particular education systems. What we're seeing is that those particular schools and entities are 3 times more likely to opt out for immunizations, especially the MMR, that's going to do from religious or a conscientious belief. And because of that, we're seeing an increase in those surging cases, the largest since 2013 when there was 23 cases in Texas. Now we're seeing another case from New Mexico that's even crossed state lines into the southwest, into New Mexico, where a couple of more strands and cases had exist over there. So what we're looking at for the future is education, reducing time away from school and or businesses. And typically what that might look like is in Clarks County, for example, it was $3.4 million that was devoted to education and loss of time and revenue spent on hours. So that's where that projection comes from. A standard MMR vaccine cash with a coupon from GoodRx can range from $90 to $120, and some states have out of cost zero because of insurance co-insurance billing or particular for their state's interests. So if we're going to increase the education, increase immunization access, and reduce the opt-out, we can see that this is 97% effective from the CDC's website, and we want to make sure for public health initiative we're going to be pressing forward is going to be those particular 3 key pillars: education, access, and getting those in to reduce the numbers for future cases. And then we'll see from more officials of the cognitive benefits in the future. Thank you so much.